That is the end of part A. Now look at part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear part of a conversation between a doctor talking to a patient. Now read the question.
Hello, how can I help you today?
Hi, I have been experiencing some uncomfortable symptoms and I think I might have herpes.
I see. Can you describe your symptoms for me?
Well, I have some painful sores on my genital area and I have been feeling very tired and achy lately.
Okay, those are definitely symptoms of herpes. Have you had any previous outbreaks, or is this your first time experiencing them?
This is my first time.
All right. I'm going to recommend some antiviral medication to help reduce the severity and duration of your symptoms. I will also give you some advice on how to manage your outbreaks in the future.
Now look at question 26. You will hear a part of a speech given by a healthcare professional. Now read the question.
Another type of specialty contact lens is hybrid lenses. Hybrid lenses combine the best features of both soft and gas-permeable lenses. They have a soft skirt that rests on the sclera, while the center of the lens is made of a gas-permeable material that provides clear, crisp vision. Hybrid lenses can be used to correct a range of vision problems, including astigmatism, myopia, and hyperopia. In addition to scleral and hybrid lenses, there are also custom soft contact lenses and rigid gas-permeable lenses that can be made to fit irregular corneas. These lenses are made using advanced computer-aided design technology, which allows for precise and accurate fitting. Overall, the benefits of specialty contact lenses for people with irregular corneas are numerous. These lenses can provide improved visual acuity and reduce visual distortions, allowing individuals to see more clearly and comfortably. By working with an optometrist to determine the best type of specialty contact lens for your unique needs, you can take proactive steps to improve your vision and quality of life. Thank you.
Now look at question 27. You hear part of a conversation between a nurse and a patient. Now read the question.
The most effective way to prevent complications is to manage your blood pressure. This includes making lifestyle changes such as reducing salt intake, increasing physical activity, and maintaining a healthy weight. In some cases, medication may be necessary, as we discussed earlier.
Understand. Can you tell me more about the role of physical activity in managing blood pressure?
Exercise can have a significant impact on blood pressure, both in the short term and long term. Regular physical activity can help lower blood pressure, strengthen your heart, and improve overall cardiovascular health. It's important to find an exercise routine that works for you and to stick with it.
That makes sense. What kind of physical activity do you recommend?
It's important to find an activity that you enjoy and that fits into your lifestyle. This could be anything from brisk walking to swimming, cycling, or dancing. The key is to be consistent and aim for at least 30 minutes of moderate intensity exercise most days of the week.
That sounds doable. I'll start by going for a walk every day and see how that goes.
That's a great start, Mr. Smith. Remember, making small, sustainable changes is the key to long-term success. And don't hesitate to reach out if you have any questions or concerns along the way.
Now look at question 29. You will hear a part of a speech given by a healthcare professional. Now read the question.
Another benefit of CT scanning is its speed and efficiency. CT scans can be performed quickly, often within minutes, which can be critical in emergency situations where time is of the essence. The efficiency of CT scanning also reduces the need for multiple imaging procedures, which can reduce patient exposure to radiation and minimize costs. In addition to its diagnostic capabilities, CT scanning is also used in radiation therapy planning. The high-resolution images produced by CT scanning can be used to precisely target radiation therapy to cancerous tissue, while minimizing radiation exposure to healthy tissue. Despite its benefits, CT scanning does have some risks. The use of ionizing radiation in CT scanning can increase the risk of cancer, particularly in children and young adults. However, advances in technology and imaging protocols have reduced radiation exposure in CT scanning, making it a safe and effective tool in radiography. In conclusion, CT scanning is a powerful tool in radiography that provides detailed, cross-sectional images of the body. It is useful for diagnosing a wide range of medical conditions and can be performed quickly and efficiently. Despite its risks, CT scanning is a safe and effective tool in radiography that has revolutionized the field of medical imaging. Thank you for your attention.
Now look at question 29. You hear part of a conversation between a GP and a patient. Now read the question.
Are there any side effects to the treatment options?
Some medications can have side effects, but we will monitor you closely to ensure that any side effects are managed effectively. It's important to follow the treatment plan closely to improve your quality of life and prevent complications.
Thank you. I'm willing to do whatever it takes to manage my symptoms and improve my health.
That's a great attitude, Mr. Hernandez. We'll work together to develop a treatment plan that is tailored to your needs and preferences. It's important to stay active and engage in physical activity as much as possible, as this can help improve your mobility and overall health.
I'm glad to hear that. Can you tell me more about the medications that are used to treat Parkinson's disease?
Sure. The medications we use to treat Parkinson's disease include levodopa, dopamine agonists, MAOB inhibitors, and COMT inhibitors. Levodopa is the most effective medication for managing the symptoms of Parkinson's disease, but it can have side effects such as nausea, vomiting, and dyskinesia.
What are dopamine agonists, and how do they work?
Now look at question 30. You hear a part of a conversation between a healthcare professional and a client. Now read the question.
Hello, how can I help you today?
Hi there, I'm concerned about fleas and ticks affecting my pet. What can I do to prevent them?
Great question. Fleas and ticks can be a real nuisance for your pet,
but there are many effective strategies for managing them. The first step is to make sure your pet has a regular flea and tick prevention treatment.
Okay, any recommendations for the best treatment?
Yes, there are many available, and it depends on your pet's lifestyle and needs. Some options include topical treatments or oral medication. I can help you choose the best one for your pet.
That sounds good. What else can I do to prevent fleas and ticks?
Another key strategy is to keep your pet's environment clean and tidy. Regular vacuuming and washing your pet's bedding and toys can help get rid of any flea or tick eggs or larvae that may be hiding out.
That makes sense. Is there anything else I should be aware of?
Yes, it's also important to be vigilant and check your pet regularly for any signs of fleas or ticks, especially during peak season. If you notice any symptoms such as excessive scratching or biting, it's important to bring them in for a checkup right away.
Thank you so much for your advice. I'll definitely keep all this in mind.
You're very welcome. Let me know if you have any other questions or concerns in the future.